What does resilience mean to you? And how have you seen resilience show up in the lives of the folks that you work with?
Okay, so I need to say that in 2003, I had a drug addiction. I got incarcerated for about 6 months. During that 6 months is when I decided to get tested for HIV. And I found out that not only did I have HIV, but I found out that I had AIDS. And so at that moment, resilience was non-existent in my life. I thought I was going to die. And I just kept waking up every day and I was still here. So I felt like so they sent an official visitor to talk to me. And I felt like it was a divine intervention because this person not only was a linkage specialist, not only were they a member of ACT UP, but they were also a person living with HIV, living with AIDS for over 20 years. And so there came the hope, and that was the bridge that I needed. So I felt like God provided me a mercy in sending me that person. And from there, I had hope. If he could live for over 20 years with HIV, maybe I had a chance. And so when I came out, I reconnected with this person, and this person sort of like guided me to ACT UP and guided me toward activism. And I believe it was through activism that I found that there was a need to fight. There was already a fight going on. I needed to be a part of this fight, and that it was important to like not be silent.
Here in Guatemala, the call of religious leaders to respond to HIV has been very slow and very sporadic. I think it's always come almost exclusively from women religious and other faith-based organizations. I think the hierarchical nature of the structure of our church has meant that grassroots workers always needed what I quote the approval of the priest or the bishops. Resilience, I think, has been built one step at a time and mainly through perseverance and tolerance of the cultural and religious bias that are prevalent in Guatemala. We've had to slowly introduce the idea of sex education and HIV prevention into the parishes and church movements. Yet once a priest is on board, we can move ahead and we can move mountains. We've had to work at transforming the mindset of the decision makers, emphasizing that some topics, although questionable to the hierarchical structure, need to be tackled as soon as possible, such as condom use, sexual orientation, and diversity, because for so long they've been seen as taboo subjects. So as I said, for me, resilience really has also meant patience.
Okay, my journey of resilience related to HIV or drug use. So, I'm from Nagaland, which is a Christian state in the remote corner of the Northeast India, which is bordering Myanmar. I got into drugs and alcohol during my adolescence years. But yes, I was finally able to quit drugs by the age of 21. But during my drug using days, there were lots of problems. There were lots of problems, not just from the families or even from the church, because when we're talking about a drug user, then it's all about judgment and it's all about morality. I think I'm lucky. I'm lucky that I got sobered up soon, unlike many of my friends and pursued my education. And I'm also lucky to have support from my families and also from the church. I started working in the field of HIV from 2005, and prior to that, the word HIV was kind of very, I was allergic to the word HIV because it has so many judgment attached to it, so morality attached to it. As I started working with an NGO, which was under Illiterates Christian Society, and this Illiterates Christian Society, they mobilized the churches, and so the project was also known as the Churches Alliance for Community Support. I started realizing, after I started working in the NGO, I started realizing that HIV is not the end of the world. Slowly, yes, working with the NGO, especially with the support from the church, it was helpful for me. It was really, really helpful for me. So I kind of motivated myself and went for HIV test. So of course, yes, my test result came out positive. Then suddenly I thought, I need to come out. I need to come out with my status open in public. because there were lots of positive people in my town who needed help, or who needed encouragement, who needed mentorship, who needed someone to guide them, someone to lead them. I was able to convince, I was able to talk to my parents, I was able to talk to my family members, and they were very, very supportive. So I decided to go come public. And I think one of the strengths that that I had was the kind of support that I got from my family members. Number one. Number two, the church. The church was so supportive. And that's how I started my journey.
I was not born as a drug user. Drug user happened much later. The family which I was born was a very dysfunctional family. I didn't use drugs out of curiosity or interest, or somebody was doing drugs or something. I started using drugs because I was not feeling good. In 2005, I got some help. I found some friends from where I started, thinking about life, taking life in a different journey. Before that, I just wanted to, basically, I just wanted to give up and I just wanted to die. So in 2005, that's how I introduced with the HIV program also. That was my first way forward to, look life in a different way. So yeah, I started my journey as a peer educator, working in harm reduction program with the people who inject drugs. And yeah, it was difficult then, and still it is difficult, because drug users and other marginalized community are always seen as unworthy or criminal people. Since we have a harm reduction program in places now, but still the challenges is there, and the very reason is criminal sanction and the moral narrative against us. I think still HIV is seen as some kind of sin or curse. If you see the HIV prevalence among the injecting drug users are still high in the northeastern region of India. The reason is community voice are most of the time unheard. There is some kind of tokenistic approach which has always built a huge gap in our health system and service provider and between communities. These are the challenges that the PL-HIV community and the drug user community still face. And one of the biggest challenges that we cannot deny is that the dehumanizing of drug user community or certain other marginalized community, gay people, transgender, sex worker. And this is one of the biggest battle. I think we need more attention. And I believe that's one of the reasons we are here talking about it. And I think with the collaboration and a continuous dialogue and development, HIV in HIV response, I see a better world for all the marginalized community.
I was born in rural Zimbabwe, and I just want to position the issues of poverty and the importance of family. And later in life, HIV was on our doorstep at a time when there was no access to treatment, and therefore internal strength for the family had to be that family cohesion, that family support, but also the church. That psychosocial support provided by the faith community was very critical, but at the same time, we could see that there was no access to treatment. For me, the family and the community became an immediate pivot in building as a critical aspect of building resilience, but finding solutions. When I had this opportunity to serve in the United Nations, it struck me then that there was a growing commitment to HIV, and then UNAIDS was formed. But I could feel the distance between that life in the village, that experience in the community, with these global discussions, these global conversations, the development of guidelines. And so for me, that experience remains that global policy is important, but is insufficient unless if it connects with what is happening at the individual, at the community level. We must address the issues of children, because HIV and children There's so many dimensions which require the collective responsibility to protect the rights and dignity of those who may not be able to do so for themselves. The issues of inequalities became very, very clear, that it is mostly those who are poor, it is the women, it is those with minimum livelihoods who are on the margins of access to services, on the margins of being in the decision-making table, and therefore this whole discussion of leave no one behind for me is about non-discrimination and inclusion. My journey in the last 5 years that I can speak concretely to, working with girls and adolescents and HIV, we know that when girls are raped and abused or married, or there is FGM, they are cut, we know that it increases risks. And we also know, especially here in not only in sub-Saharan Africa, but also in Southern Africa, that the highest vulnerability is among the adolescents. And that's where we also have highest cases of HIV. We also have highest cases of gender-based violence. And the moralization, the issues of morality, always the girls are blamed. Even when they were born with HIV, there is always an assumption that they are being promiscuous. When they are actually being sexually exploited, they're at risk. We don't have enough programs to do with comprehensive sexuality education. Issues are still treated in a taboo manner, and it increases the risk. And at the same time, we have the huge range of lack of access to services. At times, it's not that the clinics are there, but there is a lot of moral content in these clinics that a child or an adolescent or a girl is asked all these questions and blamed before they are offered the treatment. So we really need to deal with the issue of attitude in accessing public services, and especially healthcare services. We also have been, as Rozaria Memorial Trust, been supporting hundreds of children to go back to school. The school can also be a place of stigma, but also a place of healing. We need to continue to build an environment which is at the family level, the school level, and the community level, which is welcoming. But within that is the important role of faith. And at the same time, what we have experienced is the double-edged perspective where faith communities can be communities of healing, communities which offer healthcare services, communities that have empathy. But we also see that there is that moralization, but there are also issues around some faith communities which do not believe in modern medicine. And therefore, a child might be positive, a girl might be sexually exploited, but they don't go for testing or treatment. Within the context of COVID-19, we have seen an increase in gender-based violence. We've seen a high increase in child marriage, in teenage pregnancy. The focus is now on the COVID-19 virus and not sufficiently addressing all these other issues such as HIV and gender-based violence, although these are issues which are very visible. Therefore, I'm very much calling on the faith communities to have an approach that is holistic, that is integrated, that looks at the totality of life and not do a single disease kind of intervention. Resilience is both at a personal community level, but it's also at our institutions. As long as our public sector institutions do not have internal capabilities, including domestic financing, it means we'll always be looking at the external, the other people, the partners out there to resource our work. Yes, we need partnership. Definitely partnerships is critical. Our girls, people living with HIV are able to access treatment, to live without discrimination, to go to school and to have jobs and to live in dignity.
Yeah, if I think about resilience, It takes me back to the start of the days when I just heard I was HIV positive. When 33 years ago, HIV was a death sentence. There was nothing exact. When the doctor informed me that I'm living with HIV, he said, you might have a few months, it might be a few years, but you must be ready that you might become ill and die. It was also a very lonely time because of the stigma that was associated with HIV. And therefore, who do you tell? If you tell, what's the consequences? I think we have seen, in terms of resilience, personally, that your faith is something that I could hold on to. Without my faith, I would not have hope. And without hope, what's the sense? And also for me, the important part for me as a Christian was to be able to say, I have hope in the midst of my situation, not despite my situation. Because of my faith, I can look forward. And one of the things that helped me was a picture that was painted, or a painting by Maxwell Lawton, that depicted Christ with AIDS. And in the early 90s, when I showed this, people got angry. How can you put a picture of Christ with AIDS? But that's the Lord that I know, the one that was willing to stand in the midst of people and carry their burdens like it was. So if I would be depicted as having too much grace, so be it. And I think that was the thing that I've learned in terms of resilience, that I'm not standing alone. I'm standing with other faith leaders who have the same insight. The Waheedahs and the D's and the Nyaradzayi of the world, the people from Anarela and Inarela that were willing to say, here I am going to face the stigma, the resistance from my faith community. I need to speak the truth with love. And in that, we stand for the whole human rights, every part of it. We stand together as people of faith, and we continue to call that everybody has the same access to treatment that I have, including children, and that we must continue to breach the gaps that there are in terms of poverty, and do that as partners, people of faith, people living with HIV, and people of non-faith actors to address this.
So much of what each of you have already said, definitely, I think, resonates so much because of the ways in which we've had to become resilient, and we've had to, practice resilience as an act of grace, as an act of discipline. Even there are times when I'm certain in my own life where I would have rather this is too difficult, this is too tired, let me not, I'm over this, right? I'm done with this kind of activism, let me go find something else to do. And it's resilience that calls us back. It's resilience that called me back to say, oh no, you can withstand, right? You can face the folks who are trying to discourage the efforts that you're trying to do. You can be an extender of grace, and thereby, by extending grace to those who we think don't deserve it, we expand it even for ourselves, right? So can you describe for me, Christo, what has been your experience facing challenges from within? And you mentioned this a bit earlier, from within your Christian tradition. How have you been able to cultivate the expansiveness of minds and ideas and principles of faith and grace?
I am actually extremely thankful for HIV, because thanks to HIV, I got to meet people who think differently than I, that are different in culture, different in sexual orientation, different in religion. And in that, I started to understand people's stories and their lives and their callings, and understand that people are different in their, might be different in terms of who they are, but the things that drive them and the principles according to which they live are the same. And due to that, I could start to appreciate what people stand for. And I could learn. The biggest lesson I learned is I have to open myself to be able to listen and learn from others.
At the end of the day, I have come across every now and then that when there is funding available, everyone is willing to work. And when the funding stops, then their commitment and their work stops. Second is the judgmental attitude. I want to share a story. It is about a friend of mine who was also from a drug using background, and then she's also HIV positive. When she fell in love with a guy and then they want to get married, and the guy is not HIV positive. The parents of the guy, they were like, no, you cannot marry. You cannot marry to someone who has a drug using background and who is already an HIV positive woman. And they gave an ultimatum to her that if you want to marry my son, you have to stop, disclosing your status, your HIV status, or your past life. At the end of the day, it's about the morality. And this, I have seen this with many of the women drug users, whether they are positive or negative, HIV positive or negative. I've seen this. I have come across a lot of women. Even though they have stopped using drugs, they have built their life, they're living a positive life. But when it comes to marriage, it becomes a little difficult. But when it comes to men, they don't have problem in getting married. But then when it comes to a woman, there is always a judgment. We have to think about the marginalized community and treat everyone as equal. And why is there unequal treatment between men and women? With regards to stigma and discrimination, using the church platform to address stigma and discrimination it's the greatest. And the church has to again renew its commitment to work to address the stigma and discrimination that is associated with the marginalized community.
I come from a place where many of my friends who are drug users and living with HIV have a firm belief in, their faith, and though they feel quite reluctant to, participate or to visit certain. So my recommendation would be, just treat us like human beings. We are not different. Just because I'm living with HIV or I'm using drugs doesn't make me a bad person or doesn't make me an immoral person. So coming from this small, tiny state and tiny population where suicide and mental health problem is so high, and especially this is among this marginalized community, especially a drug user community. And I think faith-based organization can do a lot to address things which is so important in terms of HIV prevention, in terms of mental health prevention, in terms of TB prevention. And TB is also considered in my state is one of the highest. And on top of that, there is so much of stigma and discrimination. One thing that I have noticed during my journey, I found the stigma and discrimination is more in the institution rather than the society. And that really worries me.
I would love to hear from you all about the solutions that are homegrown from the things that you have done, but also the things that you've seen others do around the world to increase access to HIV medications or to expand human rights.
And words have power. And we've been really trying to get people to understand to use people first language when speaking about HIV. That you don't talk about the person's condition before you identify the person as a person, right? So even with our best intentions, we have to be careful that we're not stigmatizing the very people that we're attempting to support and to help. So I'm saying it to say I think it's very important to have people who you're trying to help, have those people who are impacted at the table, make space at the table for those people.
And so two things come to mind when I talk about tension and about my faith community. And one is, I find it really difficult to continue witnessing in a church that is full of stigma and discrimination at times. So even for myself as a woman in the Roman Catholic Church, I know I still don't have equal standing with male religious leaders. At the moment, people in rural areas are struggling to find enough food, are struggling also to look at how they can go for treatments. And so the stigma and discrimination that I experienced against people with HIV over the years, it's almost, they don't have time in some ways now to be discriminated against, because people are trying to live, because of all the other difficulties that are going on. We have empowered, and women and men are empowering themselves, and children are empowering themselves around HIV, but our church leaders are still not empowering themselves to understand sometimes what HIV is. Resilience is walking every day with people. And if some of those people have HIV, well, some of them have HIV. We also work with people with TB and co-infection of HIV and TB. And we know that that's because their social conditions in which they live are the ones that also makes them more susceptible to having TB. So as faith communities, we have to look, and especially I think this is where we, with our Catholic social doctrine, are called upon all the time to look at the holistic, the whole picture of health, and look at how we're involving people who happen to have the virus in building resilient communities, because the giftedness of all of us, whether you have a virus or not, whatever your virus is, or TB or HIV, your giftedness, your call is to build resilient communities. And in order to do that, we have to be inclusive. We cannot be separating people because of a status. We cannot be doing that. And so that for me is tension, because when I first started, you know, a Roman Catholic sister talking about sex, well, I had no place doing that. That's not my place to talk about sex. That's not my place to talk about condoms. It's not my place to accompany sex workers. And really, for me, definitely over the years, I've come to realize that the strongest advocates for human rights and for getting rid of stigma and discrimination are the people who are subjectively affected by HIV.
You know, if I think about what really helped the religious communities and religious leaders to build up resilience with HIV, then it is your entry point. If we start with an entry point of a specific religious kind of perspective and doctrine, then you're not going to move anything. But the moment religious leaders, similar to what I have gone through, have heard the stories of people living with HIV or families that was affected by HIV, and they hear and they connect that with the right science and the right and the ethical and challenges, but linked to their own scriptures, then things come together. If you start with the brokenness and help people to also, faith leaders to understand that they themselves are vulnerable, the moment that personal brokenness happens, then people get committed to engage on HIV because they have been broken themselves. And then they can speak up on behalf of others. That's point one. The second part is we should never, when we think about starting a new campaign or promoting to address stigma and discrimination, bridging collaboration, we can't do that just to say we must do it with the faith communities, or the faith communities must be used to do that. Then we instrumentalize faith. We can only get people across, faith leaders across all the spectrums of faith to engage when this becomes a personal calling, when this speaks from their scripture. And therefore, I have learned in terms of the work that I've been done with World Vision and with CAPSA and before that is, after you get the brokenness, you need to connect this to what does my faith call me to. And if you connect it to some guiding principles, which is clearly from their own scriptures, then people faith leaders build up resilience because it becomes a calling, not a job.
In 2014, the African Union launched the campaign to end child marriage. And I continue to say what is called marriage for children does not exist legally, because the international norms and the African instruments do not allow marriage of children, and many of our constitutions as well. Therefore, for me, this is a campaign against sexual exploitation and rape of children. What has been evident in the work is that when we focus on ending child sexual exploitation and abuse, which is child marriage, we are also reducing the risk and vulnerability to HIV. And when we work and support survivors of child marriage, we are to rebuild their social and economic assets and opportunities in life. We are at the same time working with young women and girls who have or are living with HIV. So the interrelationship between child marriage and HIV is very concrete. In terms of the experiences of the work with faith communities, first is to realize that there are equally moral issues within the whole conversation on marriage. I think we had Naro talk about the differential attitudes towards women and men related to marriage, the discrimination, the discriminatory attitudes and stereotyping that is embedded in that conversation. So it's very clear that for us to end child marriage, it also required an engagement with traditional institutions and with religious institutions, because in many of our countries, the law that allows marriage of children is justified on the basis of religion or on the basis of culture. It's therefore an imperative to work with faith communities because it means having to engage with the moral values and the theology or the thinking that is within community. But what it has also meant, and which builds on our work over the years on HIV, is to say, when we talk about engaging faith communities, what exactly are we talking about? Because at times that discussion is narrowed to just engaging the faith leader. But a faith community is both the leadership and the laity. So it's very important when we talk about faith communities to go beyond the leadership and also say people of faith, what are the behaviors, the attitudes, the ways of life is an expectation to the faith community as an institution and to the individual members of the faith community. And this is where the Interreligious Summit started with personal commitment. We need a personal commitment in addition to institutional commitments. It's also important, and it's been my experience over the years as AU Goodwill Ambassador, that faith communities bring an extraordinary, unparalleled resource of convening. So faith communities are connected and convening all the time. There is a self-organizing, which is organic, which is integral to the identity of faith community. And that's a huge resource for our fight on ending and preventing HIV and ending child marriage. And I feel that has not been maximized sufficiently. And therefore, some of the resources that has been brought forward by other organizations like World Vision, Inerela, are all gifts to the faith community on how we can resource from within.
And I would love to hear from each of you around the ways in which COVID has shaped, reframed, renewed, restored, and even how you have reimagined your HIV engagement, advocacy, and work, providing care and all.
Yeah, obviously COVID has disrupted all of our lives and our ministries. But what I saw was the faith leaders, again, building on the resilience part, the faith leaders who was already activated, who has been catalyzed and mobilized and got it, and is really passionate to stand up for that's right, were the ones who spontaneously started to combine COVID messaging with the other messaging that they carry. Through a basic little small thing like a WhatsApp messaging, these faith leaders started to unite with one another and made sure that the right information is being shared. And they were fighting the new stigma, the new discrimination of people with COVID, and the misinformation that was going around. They were able, because of what they have done with HIV, to start to act up and speak the truth in terms of the COVID situation as well.
Some really good stuff is coming out. We have a group of women living with HIV who have been trained. We've trained them and empowered them as community advocates. And we found that they're actually mobilizing their own communities in all kinds of ways at the moment. And so it's really wonderful that the women who for so long felt discriminated against are actually now the ones taking the lead in the communities. We also, some of the challenges we've been finding is, for example, because people in Guatemala, especially rural people, they live on the breadline, to be honest, and they have very little money available sometimes, even just to pay transport to get to the clinics to pick up their HIV medicines, their antiretroviral medicines. So we're trying to mobilize other people in the community and bring in those people, maybe who have a pickup truck or a motorbike. I think positivity is so important, to remain positive about everything. And I also think, Aquarius, I think that for me has in many ways been my saving grace in these 30 odd years of working in HIV, that I'm naturally a positive person, and I try always to look at what's the good that can come out of this.
What recommendations do you have based upon your experience and in relation to your focus areas that help us to identify concrete actions that faith leaders and individuals and communities can take to promote the increase of access to treatment and medications, that promote human rights, that address stigma and discrimination, and that build bridges of collaboration among different faiths, as well as people who profess no faith?
Faith communities across all religions bring an extraordinary outlay of services in communities. The recommendation and the expectation, therefore, is to integrate concretely interventions around gender equality, ending child marriage, preventing HIV, supporting people who have experienced these violations, into the services that are provided by the faith communities themselves. And faith communities at times are present even where our governments are not able to access. Because in every village, you would find somebody who professes to some faith. So we are a resource that is permanently present within the communities, and leveraging that is very critical. So my work as AU Goodwill Ambassador and within my work in Rozaria Memorial Trust is to recognize significantly this power, this potential, this inbuilt resilient capabilities that exist within faith communities. But that potential is held back by the stigmatization that still continue to exist, by the moralization that continue to exist. And therefore we need to continue to reclaim that faith communities, and the role of faith is to promote human rights and human dignity. There should be no contradiction between rights, faith, and dignity. It is about justice. The faith communities have, over the years, evolved different methodologies and approaches and programs and campaigns, which we just need to scale up. There are all these initiatives that are there already that we just need to continue to provide energy into, to continue to build capacities. The building of capacity of the leaders within those initiatives remains very important, but also recognition. It's important that public sector builds recognition. And my last is a recommendation on accountability. Faith communities should accept where faith communities would have let down humanity in terms of speaking out. Listening to my colleagues, I think we really need to talk about some of the discrimination that has been experienced and to say this should not happen within a faith community. But we need the divine courage. We need the divine courage to speak to issues which at times are difficult to speak to. When faith communities speak to the political elites, and mostly men, to say no to violence, no to armed conflict, we are actually creating an environment of peace that allows access to services and potential. And lastly, it's a call to action to have the courage to speak to the issue of resources. Therefore, this whole argument and discussion on poverty requires faith communities to have the courage to connect the dots. The micro is macro. The personal is part of the public conversation. And it takes the courage, the collective courage of faith communities to raise the fundamental issues around inequalities on resources, accountability on governance, and services at the very personal level, because that is how we can address the integratedness of human rights and inequalities that exist.
My one recommendation would be like if church faith-based organization can have people from the community to reach out to their respective community, like the marginalized community, because only a person from the community with having the same kind of experience will have a more effective, will be more effective in terms of reaching out to the community. We don't see any women leaders when it comes to drug use women. So this needs to be looked upon, and it will only be done when the judgmental attitude is done away with, when the stigma that attached to being as a woman and a drug user is done away with, and when spaces or platforms are being provided for women to come out and share their issues or address their problem, then we have a chance of seeing that zero discrimination, zero stigma, zero discrimination in terms of HIV and AIDS.
My key message would be humanize us and our concern, and also help us to build a consensus and also a synergies on a health, human rights, and harm reduction services. Request or my appeal to the faith leaders and faith organization is that we are part of this, the whole thing, and then I know what can together, what can be brought to address the HIV and AIDS issues. And with the collaboration, I think we can do wonders. And I always felt like, even in some of the workshop and even in some of the conferences, that I always felt that if somebody is missing from those conferences and those dialogue, it's the faith-based organization and the faith leaders. And I feel your presence, your concern will definitely help to address HIV and AIDS, and also the people who is affected with HIV and AIDS.
There's nothing that can separate us from the love of God. And so I want to thank all of our participants today, our faith leaders and people of faith from around the globe who are doing this work tirelessly, who are doing it day in and day out. And so we are truly, truly fortunate and blessed to have people like you working. And we hope that by some measure of faith, that what we're doing is making a difference. So thank you one and all for your time, for your energy. Keep the faith, stay safe and well, and we will see each other on the other side of this. Thanks so much.